health workers in some countries and the United Nations agencies have raised alarm that women and girls are being deprived of their rights to access crucial healthcare due to resources being diverted due to the coronavirus outbreak. Global health experts warn that despite the novel coronavirus is here to stay, denying women and girls their reproductive and maternal health rights, and this may lead to maternal death. As we observe the International Day of Action for Women's Health today, we shine the spotlight on maternal health and reproductive health rights. We're joined by Dr. Manala, Makua, the Chief Director of Women's Health at the National Department of Health. Doctor, a very good morning to you.
Good morning, and good morning to your viewers.
28th of May was declared as the International Day of Action for Women's Health in 1987, I understand. The Day of Action was initiated, I guess, as a platform to raise awareness and spread information on issues pertaining to women's sexuality and sexual and reproductive health care. What would you say, Doctor, is the most pressing issues currently, given that we're dealing with a pandemic?
Thank you very much for giving me the opportunity to engage with the women, and I want to wish all the women for the work well in terms of the effort that they took in making sure that we address the needs of the women of this country and globally in terms of sexual and reproductive health. I must say that we've come a long way. And now we have got a lot of things to celebrate, but also we agree that we still have to address some of the issues. I think South Africa has done some work in terms of making sure that women of this country are able to access the services on sexual and reproductive health.
Yeah.
But the challenges that we're still having is issues around stigmatizing some of the services that you are providing, and also not understanding the implications and the impact of inability to access some of the sexual and reproductive health needs of women in this country.
Reportedly, Doctor, reproductive health rights groups have warned that gains that the African continent has made in reducing maternal and infant deaths are now being pushed back because of this pandemic. From your knowledge, are African countries neglecting sexual and reproductive health as they try to deal with fighting COVID-19?
I think I need to applaud our leadership in making sure that despite the pandemic, the services for maternal and child health has always been declared as an essential service. And it has always been the priority for the department. Hence, even if there were changes and there were restrictions, we always declared as a department to say maternal and child health services, sexual and reproductive health services need to be continuing. And I must say, I did also need to applaud the partners that were helping us to make sure that they make us aware if there are some disruptions in some points, to make sure that we intervene as quickly as possible.
Doctor, we're fast running out of time, but I want to throw the spotlight on providing quality sexual and reproductive health care to women. Talk to us about the new national integrated sexual and reproductive health and rights policies. Does it go far enough in the right direction in terms of a rights-driven approach? I want you to just think about that for a bit, because we need to take a quick break, I'm told, because we're fast running out of time. We have to say goodbye to our SABC2 viewers. Doctor, please stay with us. We're going to continue this conversation after this short break. To our SABC2 viewers, thank you very much indeed for joining us. For those who have access to SABC News, stick around, get you more news next.